This is Dr. Corey Maas on Looking Your Best. Today we wanted to talk about a very frequently asked question, which is about the non-surgical options for getting hair growth or even keeping your hair. And there are a lot of options out there that are exciting, and there's new technologies every day that we talk about. In the area of drugs and medications, I classify them, and most of us do, into two categories. One are the topical medications, things that you can apply to the scalp to promote hair growth or retain hairs that are being lost. And that can be true in men and women. So I want to be clear, men's pattern baldness usually starts in temporal recession and crown balding, whereas women get general crown thinning and balding. And both of them can be responsive to the topical and oral medications. The one that most everyone knows, which is now over the counter in very low concentrations, is called the drug is Minoxidil, or the generic name for it, but it's known as Rogaine in the marketing world, and that's 2% Minoxidil. And when used in studies, it shows that there is certainly a reduction in the rate of hair loss. So you lose less hair. It helps to retain hair for sure. And particularly in the crown, there is new hair growth. As long as there is vellus or little peach fuzzy types of hair there, it turns them back into terminal or thick hairs. And in statistical studies, there is definitely a regrowth of the vellus or fine hairs back into terminal hairs, as well as hair retention with the use of Minoxidil. Now I say 2%, that's over the counter. In most of the products that we use that are medical level and prescription level, we're using 4%. Some people get as high as 6% Minoxidil. There can be a little scalp irritation with that, but we definitely see better results with prescription level topical application of Minoxidil, which its brand name again, Rogaine, 2% over the counter. And so that drug was originally a blood pressure medicine, and they noticed hair growth with it, and the studies went on to show hair retention and new hair growth as long as they're vellus hairs when using Minoxidil. What we know from the use of Bimatoprist or Latisse in eyelashes is that using it on brows seems to have some effect, the eyebrows, but when we bring it up onto the scalp, where the scalp skin is much thicker, there's very little effect on hair growth. Now, Bimatoprist or its analog Lanatoprost, when used in much higher concentrations on the other hand, does seem to have a hair stimulatory effect, new hair, thickening of the existing hair, and retention of hair property. Controlled trials are still needed in this area, but in products that are off-label uses of these molecules, in particular combinations of these molecules where Rogaine or Minoxidil, remember Minoxidil is the generic name, and Lanatoprost, or theoretically even Bimatoprist, those two molecules can actually help it to topically promote hair growth. And even topical finasteride, in fact, or its analogs, may have some benefit in hair growth. Finasteride, people may remember, is Propecia, and so that is an oral medication that is approved by the FDA for hair retention and hair growth. It's I think a Merck product currently, and it is a 1 milligram per day prescription that is really a lifelong obligation. But just to review, topical medications that we know grow hair, and there are a lot of other things that have been tried out there, but the actual molecules and medicines, the molecules Bimatoprist or Lanatoprost are interesting. Controlled studies are needed. It does seem to grow hair. Certainly topical Minoxidil, and in higher concentrations better, grows hair. And then there's some evidence or data that finasteride, the same or its analogs, there's other similar molecules to finasteride. Dutasteride is the one that's most commonly discussed, stimulate hair growth even when applied topically. Oral preparations, ones that you take a pill, the one that is front and center and approved by the FDA is called Propecia. It's 1 milligram a day. It definitely grows hair. There have been reports of side effects, which if you look at the studies, there's really very little difference in these side effects, which is decreased volume of ejaculate and decreased libido are the primary ones. But it doesn't really decrease testosterone levels. It decreases 5-DHT, which is a testosterone metabolite that we know is responsible for hair loss. So in the end, it's really hard when you're talking about libido and things that are has such a profound psychological component to them. Is that really the drug, or is it a patient having a side effect? And in most of the studies, there's no evidence that these side effects are real. They're something that is a very complex area, but the overall overwhelming benefits of long-term use of Propecia or finasteride, or its analog quite possibly, dutasteride, or the other molecule is very similar, are that it does retain and grow new hair, particularly in the crown and area and the vertex of the scalp. So those are two things that can be used in postmenopausal women. It can be used for hair growth. In premenopausal women, and particularly in pregnant women, great care must be taken for men using it not to have women even touch or get around the finasteride molecule or dutasteride, because it could theoretically affect a developing fetus. By 5-DHT is needed for a developing male fetus. So there are cautionary warnings around the use of these things in pregnancy. With that said, in postmenopausal women, who are the ones that suffer the most hair loss, they may be of some benefit. More controlled trials are needed. So the summary are there's topicals and there's oral medications for hair retention and hair loss. They are grouped in accordingly. There are many more studies that are needed for all of these areas, but it's exciting that we can have different combinations of these that we can use topically and orally, and even some suggestions that smaller doses of the finasteride molecule, if you're one of the people that are concerned about potential side effects, which really haven't been seen, at least in my practice. I've seen none of what's been reported, and barely different than the placebo. And the last class that I have to talk about are the explosion of these light devices. They even have helmets now that are emitting to primarily infrared light. Infrared light's been studied in wound healing, and it does seem to decrease bacteria counts, so there are some improvements in wound healing. But other than the warmth and the increased circulation that the light creates just by warming the scalp, I haven't found any studies that have shown a statistically significant difference other than the cyclical loss of hair that we have due to stress and hormones and other things. I haven't seen any studies that have shown a real statistical increase in hair counts or hair thickness using these light therapies. They're interesting. More studies are needed. The contraptions are very funny looking and may be of some value. They even make hats that you can wear all the time for this type of thing. But we have a long way to go before we've shown that infrared light, or light of any kind for that matter, can actually stimulate hair growth, or especially in those, especially new hair growth, which is where people are most interested. Taking villus hairs, tiny little peach fuzz type hairs, and turning it into a terminal hair. So that's a summary. I mean, it's a lot of big words and a lot of medical terminology, but the summary is that there are topicals and both oral medications, non-surgical options that can promote and improve hair density, hair thickness, and even new hair growth on the head and on the scalp area. And that's true for both men and women. The only one I'd add, which is another off-label use of an oral medication, is Perona Lactone, which most of us physicians know as a diuretic or a water pill that is potassium sparing, meaning most of the water pills that help with blood pressure primarily are used, and you lose potassium, which is an important ion, part of our electrolyte system. And the molecule spironolactone actually keeps the potassium in. Interestingly, it's been shown to grow hair in many patients or promote hair growth, and also reduce the incidence of acne. And we don't know why these things happen, but it was clearly a side effect that was seen when spironolactone was used long-term in patients' new hair growth. And as such, in many patients, especially women, will use spironolactone, and many are quite firmly believe that this drug has helped with new hair growth and their hair density. That's true in men and women, but it's an area where we don't have as many choices in women, so it's often used for women's hair loss. Please don't hesitate to write us or send photos or videos to drmaas.com. And as always, we're willing to engage you and talk about what your best options might be. This is Dr. Corey Maas on Looking Your Best.